You're watching Utah's #1 news channel. This is 2 News at 10.
And coming up on 2 News at 10 o'clock, a new device making a big difference in speech therapy by giving people with hearing problems the ability to see the words they're trying to say.
And I'm Meg.
Well, most of us take our speech for granted. Figuring out sounds happens at an early age.
But for thousands of people, some of those sounds are nearly impossible to master even after years of speech therapy. But now there's some new technology that is changing that in a big way. Debbie Worthen tells us more about it.
Well, this device has been in the works actually for 35 years. Speech doctor Samuel Fletcher had the vision to use a mouthpiece like this to help people master hard sounds. It wasn't until recently that a team perfected it. Now it has everyone talking. William Brown is 10 years old.
I like to play the chaos and
Sports come easy to him, but like thousands of other kids, some sounds don't.
yeah, I can't hear the difference.
William had lots of speech therapy,
I remember using a popsicle stick.
but not a lot of success in certain areas.
The older as he was getting, the more concerned I was about him not picking up his R's and wondering how are we going to solve this problem.
William's mom, Lisa, heard about a new method of therapy.
So it was word of mouth.
She jumped on it.
I thought, oh, let's give this a try because traditional speech therapy isn't working for him.
Mom took William to meet Colleen Mitchell.
We'll start out with your vowels, okay?
Colleen is a speech-language pathologist who uses what's called the SmartPalate in her therapy.
Like a mouthpiece that you put in at night.
The device is a small piece of plastic with 124 gold sensors on it. You wear it in your mouth and it connects to a computer. Unlike traditional therapy, this helps patients see, not just hear and feel where they need to move their tongue and mouth to make certain sounds.
It completely takes out the guesswork of what they have to do, and the consistency of it works with the brain so that as they're doing the therapy, it's the same every single time.
The technology is new, and in Colleen's words, amazing.
And what happens is on the screen, as the tongue goes over the palate, it lights up little dots or little sensors that are in the mouth onto the screen. And what I can do with the computer is I can change the pinpoints of where I want the tongue to go, and they'll know exactly where I want them to put it.
I think this is the beginning of the future of speech therapy.
David Larson is the CEO of SmartPalate.
And this is the mouthpiece.
He worked with the original doctor before launching the mouthpiece worldwide. He realizes it's a big change and that some therapists will be leery to try it.
So it's really the first computer-based technology for speech therapy. It's the first tool that they have like this that exists. And so it's a hard change.
But Colleen says it's a change worth looking into, a change that cuts out months of therapy sessions and months of discouragement.
My goal always when I get them in there is immediate success. And this does it. It does it every single time. Far, fear.
That's exactly what William Brown's family found for him.
Once he could see that R sound, it just clicked.
Which is great because there are lots of things William would rather do than sit in an office.
I was playing with like 16-year-olds and they stung me pretty hard. Got a little welt.
That's probably still fun.
Yeah, it was fun.
Well, Colleen is specific to point out that the SmartPalate doesn't cure speech problems. The patients still have to do the work to strengthen the right muscles. Her hope is that it can ultimately be used in schools to help kids get immediate results at very young ages. If you want more information on the SmartPalate and which therapists are using it, go to KUTV.com.
Well, that'll be the answer to a lot of moms' prayers because a lot of kids do struggle with that a little.
Yeah, and
So,
we'll see it's going to start being used maybe nationwide, so that's great. So.
good story, Debbie.